Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. My name is Dr. Sukhdev Singh. On behalf of the Sikh Association, I would like to give you a coronavirus update today on the 24th of April 2020. This is following the announcement yesterday by Matt Hancock, our Health Secretary, on three new key areas that the government is now promoting as part of their plan. And I have those details here, and I'd like to go through those briefly with you. The first is they are expanding the testing program for coronavirus. Previously, it only applied to key NHS and care workers at the front line, and it has now been extended to a whole series of key workers and their household or family members should there be a suspicion of coronavirus symptoms. And I'll go through this in a few seconds. The second news was the appointment of a team of 18,000 professionals, including public health and doctors, who will both test, track, and trace contacts. And we'll talk about the purpose and benefit of that. The third is the introduction of an NHS app for everyone's mobile, where you can log your details and your coronavirus status, whether you are positive or negative. And with that, the government can then map all the areas in the UK and have a real-time position on where the virus is more prevalent, where it's increasing, where it's decreasing, and the density. And this is very useful information. Now, all three of these areas of the plan are to help people return to work, providing they are negative and fit to work. And it's also to identify a larger proportion of the population to see if they've had the coronavirus test. Now, the extension of this program is going to cover up to 10 million people. That is the key workers and their household or family members. The population of the UK is some 65 million, so it's a significant proportion. Now, I would like to just go through the extension of the list of key workers. They are now going to include, on top of the NHS frontline and social care workers, police officers, teachers, those in the criminal justice system, such as probation, supermarket workers, pharmaceutical workers that produce pharmaceutical products that we need, PPE workers, and food production workers. It's going to include journalists to ensure that the media is functioning properly and there is correct spread of correct information, and transport workers ranging from bus drivers to delivery vehicles like Deliveroo or others. And Matt Hancock stated that the frontline workers are feeding our communities, and we need to ensure that in this coronavirus emergency that we have enough access to food. And that's why he's now included supermarkets. And those that provide essential services in difficult circumstances, they need to be supported. And those that work long, busy hours in busy stores, they need to be supported because we are reliant on them for our sustenance. An example of the impact on the food industry is Tesco. Tesco currently has 41,000 workers isolated at home with possible coronavirus illness, and that's a huge dent in their workforce and potentially a reduction in the service offering to local communities. How is the system going to work? The government has set up a website that you log on to and post your details, including your mobile, and tick box the symptoms that you're suffering or symptoms that your household member or family are suffering. You will then be sent a text with an appointment at one of three places, either a drive-in centre or a mobile unit, which is probably going to be manned by the army. And these mobile units are like these large buses that go around. And thirdly, you may get a home kit sent to you by courier. The kit itself is going to be the PCR antigen test, which is the most sensitive and specific test. And it involves a swab that you put at the back of the nose, quite simple to use. The schematic diagram is going to be there for you to follow, and then you basically have that test done either at the driving centre, a mobile unit, or your home test, which can then be picked up by a courier. The turnaround time is 24 hours, and you should by day 2 have a result sent to you by text on your phone, telling you whether you are coronavirus positive or negative. So as a key worker, if you have symptoms and you are suspicious, have the test done. If it's negative, you're safe to go back to work. If it's positive, then you and your household need to self-isolate for the 14 days. So this is an added benefit and supports people returning to work by knowing what level your coronavirus status is. And it's a very useful preparation. The second is contact tracing, and this is part of the public health plan to try and find out the correct community position or a better community position on where the coronavirus has spread and how far it has gone. The World Health Organization last week stated that the level of testing done in most countries has revealed that only 3% of the public have had coronavirus, and this is very far from the herd immunity required of 60% or even 80% before the virus subsides. And it's only when there's herd immunity will the virus subside, or whether there's a vaccine or a curative drug. The other areas I'd like to cover today are just some general updates on the figures released. So yesterday, the death rate, daily death rate, reduced to 616, and the total number of cases is now of deaths is now 18,738. Remember, the government plan was a target of 20,000 deaths. If the government plans were exercised fully and implemented and adhered to. And it looks like we're going to go way past that 20,000 death rate. And that's a real tragedy, because 20,000 deaths or 20,000 too many. But this is now going well beyond that. Worldwide, there are 2.6 million cases reported yesterday, with 181,000 deaths. In terms of tests, yesterday there were 51,000 test capacity, of which just 23,500 tests were actually done. The government pledge and target is for 100,000 tests per day by the end of this month of April. And that doesn't seem like it's going to be achievable, but let's wait and see. So some other general news for your interest. The first human trial in Europe of a coronavirus vaccine has begun in Oxford, and two patients have been entered into that trial. They're looking for some 5,000 patients with a double-blind, randomized, placebo-controlled trial, and we will know in 3 to 4 months whether that vaccine has been effective enough for it to be used widely. There are, of course, other companies like the collaboration of GlaxoSmithKline and Sanofi around a vaccine that they are producing. An analysis by BBC of healthcare worker deaths has shown that 103 healthcare workers have died, and the disturbing figure is, of those 103 deaths, 65 are from the ethnic minority BAME background. We still do not know why there is such a disproportionately high impact on ethnic minorities. Donald Trump made 2 massive blunders yesterday in his speech on coronavirus, and he questioned his doctors on the use of disinfectants and UV light, and made a remark, are his doctors testing disinfectant injections into coronavirus patients to see if those disinfectants can work internally? The doctors said that was very ill-advised, and he should not be saying that kind of thing in public, because some public may well follow that thinking it's true advice and kill themselves, because we know disinfectants will kill you if injected. So please disregard Donald Trump's suggestion of testing disinfectant injections. He also had heard that ultraviolet light, when used on surfaces, can kill the virus, and he wondered whether we should be testing ultraviolet light within the body to kill coronavirus. And again, the doctors stated that that was not really recommended on a scientific level. So Donald Trump carries on with his usual antics, and we need to just not listen to those two particular health ones. But I thought it was of interest, a bit light-hearted. Ambient noise in the environment is reduced from 50% to 20%. And the folk that look at seismic activity and are mapping earthquakes and earth tremors say there's so much silence of ambient noise that you can now track tremors in the UK from as far away as Japan, and that's the first time in many decades. The World Health Organization lead Dr. Tedros has warned that there are upward trends of COVID-19 infection in Africa, Eastern Europe, Central America, and South America. He also warned that lifting lockdowns in Europe could reignite a second wave of coronavirus pandemic, and we need to be very cautious about lifting the lockdowns. Nobody wants to have a second wave of coronavirus illness. The countries that are most affected seem to have a plateauing of cases. So Spain, Italy, and the UK are seeing a plateau of deaths and new cases. And in Spain, for the first time, there were more recoveries from coronaviruses than new cases, and that's a big turn in Spain. Focusing on the UK, it is felt that about 80% of the population, example being Birmingham, will be infected by coronavirus. At this stage, because testing has been so minimal, we don't know what proportion of the population have had coronavirus, but the guesstimate is 80% of the population will get coronavirus in some form, and that's a huge amount of the population. That's nearly 850,000 cases in Birmingham of the 1.2 million population. Lastly, the poorest council in England, Middlesbrough, seems to be the place with the highest impact of coronavirus. So there is a definite link between poverty, deprivation, and COVID-19 disease. In London, the two boroughs mostly affected by coronavirus cases and deaths is Brent and Southwark. And that is really all the news I want to share today. As the news comes, I will give you an update on the highlights on a weekly basis. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.